Okay, so we're going to end off with our first day of week 7 by talking about how we maintain preload. Okay, remember, preload, amount of blood or the pressure that's in the heart before contraction. This is caused by end diastolic volume, which is affected by venous return, among other things. And so it's important that we maintain preload because if we don't, then our stroke volume is going to ultimately decrease, especially during exercise when heart rate increases. Okay, and so even though our heart might contract harder, if we're not bringing enough blood back, that's going to be an issue. All right, and so what we have is we have displacement of venous blood. Now, as we've talked about several times, both in this class and in our introductory physiology class, increasing sympathetic activity helps reduce blood flow. Okay, and specifically, we're reducing blood flow to the skin, to the splanchnic, or like kind of the intestines, stomach area, kidneys, and other parts of the body. Okay, and so as you can see from this old school diagram here, vasoconstriction basically prevents blood or reduces the amount of blood that will go into each of these regions. Now notice that we've got this little dotted line which indicates how much, gives an idea that it could hold more blood. This is due to venous pooling. Okay, and so we want to prevent that. And so what happens is by vasoconstricting these areas, such as the skin and the muscle, or skin and the splanchnic and the renal regions, the renal areas, this allows more blood to go to the muscle and ultimately allows more blood to get back to the heart. Okay, so one of the things that the sympathetic nervous system does, besides causing vasoconstriction, it also causes venoconstriction. And so venoconstriction is just constriction of the veins. All right, and so if we constrict the veins or we don't allow them to expand as much, this also helps get blood back to the heart, which will allow for a greater venous return. However, this is not enough. Okay, we need to help get blood back to the heart, especially when we're exercising. Remember, cardiac output can go from 5 liters a minute at rest to 20, 25, 30, even 40, depending on what kind of athlete, your size, that sort of thing. That's a lot of blood. But in order for the cardiac output to be that high, that means we need to be returning 40 liters of blood, or whatever the number is, back to the heart. So how do we do this? And the answer is something that I know we talked about in 220. I'm hoping they talked about in Bio 241 if you took that. But if not, we're going to explain it here. And it has to do with pumps. Okay, and there are 2 pumps that we're going to talk about. All right, and this is my only slide on this. So we're going to talk about the muscle pump here to start off. And so I'm going to focus on this right side. Okay, so imagine your blood vessel is a go-gurt. When your muscles contract, it's like you squeeze that go-gurt in the middle, and what it does is it forces blood to go up towards your heart. Okay, and then when you relax, it's like you let go of the go-gurt. Well, the blood would fall back down, but due to one-way valves, it doesn't fall all the way back down to your toes. And so blood going from your skeletal muscles in your legs back up to your heart, it's like a series of squeezing the go-gurt. And so we're shooting it up, it falls back a little bit. Shoot it up more, it falls back a little bit. Shoot it up more, and eventually gets to your heart. So that is the muscle pump. Okay, then we've got the respiratory pump. Okay, and so with the respiratory pump, I think I can make it this way. Okay, so here we go. We're going to try and draw. This could be a little ugly, but we're going to do the best that we can. Okay, so here is my abdominal and thoracic cavity. And remember, they're divided by the diaphragm. Okay, so here's my abdominal cavity. Here is my thoracic cavity. Okay, during inspiration, what happens is this goes down into the abdominal cavity. And so that causes volume to decrease, which means pressure will increase. Okay. And the reverse is true in the thoracic cavity. So volume goes up, which means pressure goes down. Okay. Now we've got a gradient. Okay. And so blood flow is going to go preferentially from the abdominal cavity up in here to your heart. Okay. And so I'm going to draw a green heart. So there's my heart. Okay. Blood wants to go that way. It's going to stay, for the most part, in your thoracic cavity. Okay, so while you're breathing in, you're making it easier for blood to get into your thoracic cavity. Your lungs will actually have some capillaries that open up that aren't normally open to help facilitate this to take in more blood. Okay. But to be clear, blood is still leaving your heart, still going all over your body. But during inspiration, which just to be clear, here's the I for inspiration, it's easier for blood to get into the right side of your heart and your lungs. It's more difficult for it to get to the left side of your heart out to the rest of your body. So then we've got expiration or exhalation. So the diaphragm comes back up. And so here we go. So again, we've got A for abdominal, T for thoracic. Here's my wonky heart because I'm not very good at drawing, especially with a mouse. So now volume has gone up. Pressure has gone down in the abdominal cavity, where the reverse is true in the thoracic. So volume's gone down, pressure's gone up. And so what happens here is blood goes preferentially this way. This is high to low, whereas up here, this was high. H is for high, L is for low. Okay. What happens is when you're breathing out, you're essentially squeezing blood out of your lungs into the left side of your heart so it then can be ejected and go throughout the rest of your body. So I want you to think about both of these pumps with regard to exercise. What happens to the amount, frequency, strength of muscle contraction when you exercise? It goes up, and by going up, we increase venous return. So let's think about breathing now. What happens to your ventilatory rate when you exercise? It also goes up. So during inspiration, we're helping get blood back to our heart. During expiration, we're helping to get blood out of the heart. Okay, and so these two pumps both are extremely active during exercise. They both play a huge role in increasing venous return. By increasing venous return, we increase preload. By increasing preload, we increase stroke volume. And as a result, we can have a higher cardiac output. And so that's how we maintain preload, or these are a couple of the ways that we maintain preload during exercise.